Although most Americans may be most familiar with social networking on the internet via Facebook or MySpace or even Sermo for doctors in the medical profession, what about putting it all together in healthcare? Welcome to the Clinicians Roundtable on ReachMD XM Channel 157, the channel for medical professionals. I'm Bruce Japsen, the healthcare reporter for the Chicago Tribune, and with me today is Jon Black. He's the Chief Executive Officer of CheckMD. CheckMD is a social networking site recently formed as a destination site for internet users to talk and share their experiences. Prior to CheckMD, Mr. Black founded his first healthcare endeavor, Get Proof, a web-based physician credentialing software and services company. Mr. Black has also worked in many other non-healthcare ventures, including work as a founder and CEO of North Star Direct, Inc., a training and consulting firm in Atlanta, Georgia. And he has an interesting story to tell about CheckMD, but your story, Mr. Black, is not one of the typical health industry insider. Welcome to ReachMD.
Thank you. It's great to be here.
So tell us about your story. Tell us about how you got into CheckMD and what is this new entrepreneurial venture?
I would say that it is a little bit different than most professionals out there because I come from this space really more from a personal standpoint than anything else. I've been in the healthcare industry for 10 years, and I found that in the healthcare industry, battling all the problems, doing a lot of finger pointing, and really finding what's bad about the healthcare system out there, which seems to be a focus in our country, I found that during that time period in my personal life, I was actually receiving an extremely high quality of care in my own health care. And that's when I decided to turn my focus to really focus the country on the quality of health care received as opposed to all of the politics and policies and programs and health care is broken. And certainly there are pieces of health care that are broken. But what CheckMD is all about is looking at health care from a personal standpoint, a personal level, and helping people find quality care. I'll give you one example. Just recently, my daughter was in ICU after an extensive jaw surgery. I'll tell you, at that moment as a father, sitting in that hospital room, I really didn't care about politics. I didn't care about plans that were going to give me results 4 years in the future. The only thing I cared about at that moment was the quality of care received by my daughter and getting her healthy and healed. And that really has helped me to focus CheckMD and our site on bringing together consumer advocates, bringing together folks that are interested in quality care and bringing them together into forums, providing tools and platforms, et cetera, to be able to talk about what's most important in healthcare, and that's quality of care.
Well, walk our listeners through this, if you will. Let's just say that CheckMD was available when your daughter did have her jaw problem. What would you have done as a patient or even a physician on CheckMD? Where could you go for it, first of all? And also, how might that have helped your situation?
Yeah, great question. I'll actually refer to another healthcare experience. I actually was able to use CheckMD because it was in development at the time. It wasn't launched yet, but we were doing a lot of tests on it. And so I was able to find everything I needed to find, including a quality physician, a quality hospital that had good ratings based on the national average. And I was able to do that for my daughter. I'll kind of back up a little bit and say that my healthcare journey started when I was actually a little kid and my mother was delivering a stillborn baby when I was probably about 10 years old. And she had about the most horrific healthcare experience you can possibly imagine. And there was essentially no tools. Internet wasn't even around back then, but she had really no way of knowing anything other than feeling like a helpless victim. I'll contrast that with an experience that my wife had when we had a miscarriage late in pregnancy. And because of the experience that I remember my mom talking about, and she actually had healthcare challenges for about 10 years in and out of medical centers, chronic health problems, and because of that, I was a little bit more of an informed consumer when this happened to my wife, and I was able to go out and research on my own and talk to healthcare professionals and, again, find a very high degree of quality care for my wife, and we ended up receiving the best care imaginable. And I guess I would say that has translated from a circle of influence for my own family and friends, and then, again, what I've tried to do is expand that circle of influence out to the Internet and the social networking community. And one point that I want to make is that it is an inclusive community. There are other communities out there. There are other, I would even call them rating sites out there. We are not in that category. but there are other sites out there that are all about the consumers. At TechMD, we're an inclusive site that includes everyone in the healthcare arena.
And so someone would go to, if they have a situation such as your situation with your daughter, you would go to www.checkmd.com, and what would they see and what might they encounter and what could they find in the lines of some sort of help?
There are 3 different things that they can do on a site. One is to find or research a physician or hospital, and they can do that. They can look up physician histories, etc. There is also a place for physicians and hospitals to go on and essentially say, here I am, market themselves, talk about their strengths, etc. And so they can do that in that research area. They can also go to the Healthcare Debate Central section and find out what their presidential candidates' plans are for healthcare and make their voice heard in that area.
Well, if you're just joining us, or even if you're new to our channel, you're listening to ReachMD XM 157, the channel for medical professionals. I'm Bruce Japsen, the healthcare reporter for the Chicago Tribune, and joining me today is Jon Black. He's the chief executive officer of a new company called CheckMD. Now, CheckMD is sort of a Facebook or MySpace in the healthcare industry, and we were just talking to Mr. Black, who joins us from CheckMD's home state of Utah, where we're talking about kind of how people can navigate and what they would find on this site. And so if I'm a physician listening in and I want to be a part of this, do I have to go establish my own CheckMD page, if you will, or would I be found on this page because I'm hooked up with another outfit, such as Health Grades or somebody like that?
Yeah, you would certainly be found. We have one of the most extensive physician databases in the country. I would say, first and foremost, the accuracy is what we're most proud of. But you would certainly be found if you were a practicing physician. You would be found on the site. But we are encouraging all physicians and healthcare professionals and hospitals to come on and become a consumer advocate partner, essentially raising their hands and saying, hey, I'm one of the good guys. Again, we find that the vast majority of malpractice suits are caused by a minority of physicians, and the majority of physicians out there are practicing excellent quality care. So, yes, we do ask that they come, join us as consumer advocate partners. We can actually set up their pages and link to their own websites, to their other affiliations, hospitals, etc. But they would certainly do that. The other area of our site, by the way, is just what we call our health tree communities. And, again, that's the social networking aspect that allows anyone inside or outside of the healthcare industry to blog, podcast, post, and all the different tools that there are to network and essentially help yourself by finding good quality care, help others by sharing your experiences after you've found it, and then truly fixing or reforming the healthcare system organically by one people finding quality care.
And also, does it cost a physician to join up and become one of CheckMD's consumer advocates? And also, how is this paid for? And I assume there is a secure component to this if a physician or patient wants to be a part of this.
Absolutely. Security is utmost in our minds. No, there is no cost to physicians or consumers at all to either join in the site as consumer advocate partners for the physicians or join in the communities. No cost whatsoever. It's paid for certainly by ads, but also by sponsorships of different areas of the site, and that's where everything's paid for.
And you were talking a little bit ago about health tree communities. Tell us a little bit about that, because clearly one reason a physician might join a doctor-centric site like this, like Sermo, for example, so they can talk to other doctors. Now, you sort of bring it all together with doctors and patients. Is that kind of what the health tree communities does?
Yes, absolutely. It is a place for people to come in and share their experiences. We, again, are advocating the positive, good experiences that people have had in the healthcare system, either with medications, surgeries, procedures, hospitals, health plans, anything that they want to talk about, to come in and talk about that.
But it's not the complaint factor that everybody usually gets in, like, oh, I had to wait 15 hours for my doctor, insurance company didn't pay for this, or this doctor diagnosed me with this and I had that. You're trying to tell people the positive aspects so they can get some help. Just
to elaborate on that, if you go to our physician research, for example, you'll find the word recommend. In other words, recommend your physician here. We had a user recently that said, well, I don't want to recommend this physician, so I want to move on. I want to do something else. We're kind of tracking what the user was doing. And that's great, because you don't reform anything. Nothing changes when you are continually blaming, finger pointing, and really that's one of the biggest problems in the system today is a lack of trust. Again, my experience is that quality health care is out there. It's being practiced every day. CheckMD will help you find it. But those low expectations and lack of trust that people have is a real barrier to quality health care. If you don't mind, I'll give you one more quick example. My mother recently had an open heart surgery. And again, the confidence that I felt going into that situation, having done all the research on CheckMD, was amazing. We are about confident health care. But after a 6-hour surgery, the physician came out and essentially said, my interpretation was, I saved your mother's life, things are going to be fine. She had 90% blockage. I mean, it was a bad situation, and he came out and told us very, very good news. Now, a member of my family immediately started, I called it land-blasting this poor doctor. What about this, what about this, what about this? And they were all good questions. Again, I felt like I had my answers, so I didn't need to go there, but there was obviously a lack of trust between a family member of a patient and a doctor. And, I immediately kind of stopped her and looked at the doctor and I said, thank you. Thank you for what you did for my mother. That lack of trust, we want to turn that into, again, regaining the confidence that quality health care exists and that you can find it at CheckMD.
And what about the Healthcare Debate Central? You can go on and you can listen and you can talk about your politics and other ideas as well.
Right. Right now in this country, there's a huge healthcare debate. And recently in the New York Times, there was an article about Obama's healthcare plan and what he had planned to do. At CheckMD's Healthcare Debate Central, not only can you find out what your presidential candidates' plans are as it relates to healthcare in this country, but you can also make your voice heard. You can create polls, find out what other people think. You can respond to polls, and you can chime in on the debate. And again, make sure that your voice is heard. One of the things that we're advocating is stop finger pointing, stop blaming, become a part of the solution rather than the problem, and let's all talk about what's working, and let's expand on that. And Healthcare Debate Central is one area that we want to leverage and take advantage of the current environment politically and in the healthcare system in the country.
Well, you've heard it here on ReachMD. Our guest has been Jon Black. He is the Chief Executive Officer of CheckMD, and we'd like to thank him for joining us. I'm Bruce Japsen, the healthcare reporter for the Chicago Tribune. I've been your host. To listen to our on-demand library, visit us at reachmd.com. Register with promo code RADIO and receive 6 months free streaming for your home or office. If you have comments or suggestions about today's show or any other program, please call us at 888-MD-XM157. And I'd like to thank you today for listening.
Hi, this is Dr. Sam Nussbaum, Chief Medical Officer of WellPoint in Indianapolis, and you're listening to Reach MD XM157, the channel for medical professionals.